In this lecture, we'll continue to look at circulation and gas exchange. Blood always flows from an area of high pressure to an area of low pressure. So pressure is defined as force perpendicular to a surface of some sort. And furthermore, the higher the force, the higher the pressure. But the greater the surface area, the lower the pressure. So it's essentially force divided by surface area. So blood pressure, if you're thinking about a blood vessel, would be exerted in all directions against the walls of the blood vessel. And so if we look at the aorta and other major arteries, the arterial walls are quite elastic. And this is very important for maintaining blood pressure between successive ejection phases. So if you recall, the ejection phase is when blood is actually ejected from the left ventricle, say into the aorta. And this occurs during systole, ventricular systole, when the pressure in the left ventricle is greater than that of the aorta. At that point, the aortic valve is open and blood is ejected. So that's actually occurs sort of during just a portion of systole, towards the latter half or so of systole. So there are periods of time in which no blood is being injected, and yet your blood pressure doesn't drop to zero. So why is that? Well, in a healthy person, the aorta and the other major arteries are quite elastic. So blood flows into them, it flows down them into other parts of the body. But at the same time, the pressure acts on the walls of the arteries and they expand. And so there's an increase in surface area. So this does two things. One is it decreases the overall blood pressure. So if the aorta and the other major arteries are quite elastic, then you have a certain amount of force, but the surface area actually increases due to this expansion of the diameter of these arteries, and therefore the blood pressure during systole is not really all that high. Now that changes as people age and if they're have atherosclerosis or hardening of the arteries. And in those situations, the force may be the same, but the elasticity is lower, and therefore the blood pressure is higher. Again, pressure is defined as force divided by the surface area it's acting on. So that's one important aspect. And the second aspect is the fact that in between periods of systole, when there's the actual ejection phase, you have no blood exiting the left ventricle, and yet there's still blood pressure. And why is that? Well, it's because the aorta and the other major arteries have expanded, and now they're contracting back. There's an elastic recoil, and this maintains the pressure within. They squeeze the arteries, and this maintains the pressure between ejection phases. Okay, so we talked about systole and diastole. And we're specifically talking about ventricular systole and ventricular diastole. Of course, the atria also have a systole and diastole. But let's restrict our conversation to ventricular systole and ventricular diastole. So ventricular systole is a period in which there's contraction of the ventricles on both the left and right sides of the heart. And diastole, ventricular diastole, is when there's a relaxation of the ventricles on both the left and right sides of the heart. So associated with these periods or these of the cardiac cycle are pressures. So during systole, you have the systolic pressure. Now, as I said, the left and right ventricles are contracting during systole, and so you'd expect the systolic pressure to be the higher pressure, and that's the case. It's the high pressure in the arteries. During diastole, you have the diastolic pressure, and this is when the left and right ventricles are relaxing. No blood is being ejected, from the heart, and therefore the pressure is the lowest. So you have these two pressures, the systolic pressure, which is the high pressure, and the diastolic pressure, which is the lower pressure. Now, in addition, there's actually something called the pulse pressure, which is the difference between the two pressures. And this is actually the pressure that you can feel. If you say, put your fingers on the radial artery, you can actually feel the bulging of the artery walls, and that's due to this difference in pressure between systolic and diastolic. So blood pressure is something that's highly regulated in your body. The reason for this is if blood pressure is too low, then there isn't adequate perfusion of blood of various organs in your body. Conversely, if blood pressure is too high, this can cause damage to delicate capillaries. So one of the mechanisms through which your body regulates blood pressure is by altering the diameter of arterioles. Recall that arterioles are very small arteries just before the level of the capillaries, and they have smooth muscle associated with them. These smooth muscle encircles the arterioles, and so when the smooth muscles constrict, the diameter of the arterioles decreases, and this is called vasoconstriction. And this leads to an increase in blood pressure, overall blood pressure. Conversely, if there's a relaxation of the smooth muscles in the arterioles, you get vasodilation, meaning the diameter of these arterioles increases, and this causes a decrease in blood pressure. So what are some of the things that cause vasodilation and constriction? Well, vasodilation can occur in a local area due to the release of nitric oxide from certain cells. They'll induce vasodilation of the arterioles by relaxing the smooth muscle, and this could lead to a local increase in blood flow to a particular organ. Conversely, you have the peptide neuroendothelin. So this is something that induces vasoconstriction. So it would have the opposite effect, and it would decrease blood flow to a particular organ. So vasoconstriction and vasodilation are often coupled to changes in cardiac output, which also affects blood pressure. So, for example, if nothing changed in terms of vasodilation or constriction, and you simply increased cardiac output, recall, it's the flow rate. So it's the volume of blood that leaves the heart per minute, per unit time. So let's take the example of exercise. When you exercise, you need extra blood flow to skeletal muscle in your arms and legs. And so you'd expect to have vasodilation of blood vessels, and that's exactly what occurs. At the same time, if you had vasodilation, recall that if you just had vasodilation without any change in cardiac output, then you may get a drop in blood pressure, and this could be disastrous. It could lead to not enough blood getting to, say, the brain, which would lead to a person to become unconscious. So how does the body deal with that? Well, this vasodilation of the blood vessel, the skeletal muscles, is coupled with an increase in cardiac output. And that way, the blood pressure doesn't drop too much. It's actually slightly more complicated than this, because during exercise, you may have vasodilation to certain organs, such as skeletal muscles, but at the same time, you may actually have vasoconstriction to, say, the kidney or the stomach or the small intestines. And so again, that also would help with maintaining the blood pressure. Okay, so something you probably haven't really thought about much is that blood pressure is highly affected by gravity. So if you were to measure, say, the blood pressure in a standing person, in an artery that's above the heart, then you'd find that the systolic pressure there is lower than that of an artery in, say, the leg. And that's because gravity itself exerts a force that leads to changes in pressure. So for this reason, in order to have a standard way of measuring blood pressure, what we typically do is measure from the brachial artery, which is in the arm, and it's roughly at the level of the heart. And so that'll give you approximately the blood pressure of the aorta, which is what we're really concerned with. So the blood pressure for a healthy 20-year-old male human is about 120 millimeters of mercury during systole and 70 millimeters of mercury during diastole. Now, if the person were to, say, raise their arm up above their head, you'd expect to have a different blood pressure. You'd have a lower systolic pressure than 120. And so again, gravity would have an effect. So it's actually necessary that the person have sort of a standard posture in which the arm is sort of by the side, and the pressure cuff is at about the level of the heart, roughly. So again, gravity has a significant effect on blood pressure, and it can actually lead to things like pooling of blood in the lower extremities, such as the legs. And we'll talk about how we get around that in a second. Okay, let's talk a little bit about how we actually measure blood pressure. So we are measuring from the brachial artery, which is a major artery that's in the upper arm. So you put a cuff on the upper arm. You listen to the brachial artery using a stethoscope. Initially, what you do is you want to increase the cuff pressure to relatively high pressure, greater than what you think the systolic pressure, blood pressure of the patient would be. Now, what this does is it will close the artery. And so that's shown here. You can see that the artery is occluded because of the pressure. And so at that point, if you were listening, you wouldn't hear anything, right? Actually, if we started with the patient with no pressure on the cuff and you were listening to the brachial artery at about the level of the elbow, you would find you wouldn't hear anything either. So if the artery is not occluded, you get what's called laminar flow. So the blood is just flowing through in a very smooth fashion, and so it doesn't create it. There's no sounds associated with that. And here in this picture, when the blood vessel is completely blocked, then there wouldn't be any sound either because there's no blood flowing through. So then what you would do as the nurse or doctor would be to reduce the pressure on the cuff gradually, eventually get to the point where the patient's blood pressure is higher than that of the cuff. And so at this point, during systole, a portion of systole blood will sort of squirt through, but it'll be very turbulent. So it'll come through and it'll make a lot of noise. So it won't be laminar flow. And you'll be able to pick that up and hear it quite easily. Eventually, as you decrease the pressure, the blood flow will still be turbulent, so you'll still be able to hear something until the point in which you get to the point where the cuff pressure is actually lower than or about equal to that of the pressure in the brachial artery itself. At this point, the cuff really isn't doing anything. It's not restricting the blood flow, and so blood then moves in a laminar fashion again, meaning it just moves very smoothly with not a lot of turbulence. And at that point, you wouldn't hear anything. Even though blood is flowing, there would simply be no sound. And so that would be, you could then, that's a good indicator that you've now reached diastole. So you have the two pressures, systole, so in this patient, it's 120. At that point, the pressure is just high enough so that it can squirt through, and you hear the turbulent flow. You'll continue to hear turbulent flow as long as the blood vessel is being partially narrowed by the cuff. But eventually, when the blood pressure is slightly greater than that of the cuff, then there's no change in diameter of the blood vessel, and therefore the blood flow is just very smooth or laminar, and there's going to be no sound. And so the disappearance of the sound indicates diastolic pressure, and the appearance of the first appearance of the sound indicates the systolic blood pressure. So one of the unique features of humans, due to our upright posture, is that there are situations in which there may not be enough or adequate blood flow to the brain. And then this can cause a person to become unconscious. And so this would be referred to as fainting. And so it can be quite dangerous because, of course, you could fall and injure yourself as you fall. Other animals have other unique problems that have to do with gravity and blood flow. So, for example, an animal with an extremely long neck would require a very high systolic blood pressure to pump blood against gravity up to the brain. So for this reason, the giraffe has an extremely high blood pressure, systolic pressure of 280 and a diastolic pressure of 180 millimeters of mercury. Okay, earlier I mentioned there may be an issue with blood pooling in the lower extremities, such as in the legs. Recall that the blood pressure decreases as you go through the systemic circuit. It's highest in the aorta, and then as you go to the other major arteries, it doesn't change very much because there's not much resistance. Remember, we talked about pressure as being a kind of potential energy. And that potential energy gets used up, in a sense, and is converted to heat in a couple different ways. One is there's some internal resistance within the fluid itself because it's not perfectly laminar. But also there's a lot of friction due to interaction between the moving fluid and the walls of the blood vessels. And this friction is greatest when the blood vessels are very small in diameter. So, for example, by the time you get to the level of the capillaries. And so there's quite a dramatic decrease in blood pressure as you get, particularly as you go through the capillaries. And so the venous system, in other words, the veins have a very low blood pressure in comparison to the arteries. And so they generally have thinner walls and so forth. And this pressure is so low, it's actually problematic. It's actually difficult to get the blood back to your heart, particularly from the feet and legs and so forth. And so there's kind of a clever way that your body got around this problem, and that's to put in these little valves. These are one-way valves in the veins, and they prevent black flow of blood. So each of these valves is shaped in such a way that they sort of catch the blood. So if blood were to move backwards, these are relatively, they're not like super thick valves, but they're quite effective. What happens is the blood would sort of catch in these sort of cup-like shaped valves, and that would force the valve to shut if the blood pressure were higher above the valve compared to below the valve. In contrast, if the blood pressure is higher below the valve, then the way these valves are designed anatomically, then they'll just open up and the blood is allowed to pass through. So you notice you have these chambers. So for example, here within the leg, there's a chamber in which is formed by the fact that there's a valve here that's closed, and then there's another valve here. In this particular case, the pressure here in this chamber here is greater than the blood pressure below at this particular moment. And that's because the skeletal muscles surrounding this vein are pushing in on the vein, causing it to decrease in volume. And so this increases the pressure, maintaining this lower valve closed and opening up this upper valve. And then the blood flows back towards the heart. Okay, so return of blood is also enhanced by contraction of smooth muscle in the venule walls. So the venules do have smooth muscle, so if they contract, that can actually help also aid a little bit in the return of blood towards the heart. And then here it talks also about skeletal muscle contraction, which is what's actually being shown in this picture. As the skeletal muscles contract as you're walking or running, this helps to push the blood back towards the heart through these one-way valves. One fact that's probably a bit surprising is that blood flows through only about 5 to 10% of the body's capillaries at any given time. This is surprising because the picture most of us have in our head is that the blood is flowing through all the capillaries all the time. This is simply not true. So, for example, if you look at your skin, that's an organ that's highly vascularized, and yet when you're resting, you really don't need that much blood flow through the skin. Now, it's different when you're exercising and you start to heat up, your internal core temperature starts to increase, and you need to offload heat to the environment. Under those situations, you suddenly have an increase in blood flow to the skin. The skin becomes warmer, and this is a way for your body to then release heat to the environment. So that's a good example of an organ in which the blood flow can vary between a very low percentage to a very high percentage of the capillaries having blood flowing through them at any given moment. There are other sites where in your body where most of the capillaries are in fact more or less open. So, for example, in the brain, even there is variation as different parts of the brain are more active than others. There'll be different degrees of blood supply. So, how does your body regulate the distribution of blood to different organs in the body? Well, one of the main ways that your body does this is to constrict or dilate arterioles that supply capillary beds. So, for example, if you're walking upstairs, there are going to be certain muscle groups that are active, and they might be slightly different than, say, walking downstairs. And so you'd actually have a slightly different pattern of blood flow to different muscles, skeletal muscles, as you're doing a particular activity. And so these arterioles will change in diameter to help regulate blood flow. So that's quite specifically tailored to the amount of oxygen and nutrients needed by a particular muscle. There are also precapillary sphincters. These are, again, smooth muscle, and they're going to control blood flow between the arterioles and the venules. So let's see if we can see a picture of this here. We have the precapillary sphincters here. Now, if these are open or there's vasodilation, then blood will flow through the entire capillary bed, as you can see here. Now, if they're closed, a lot of the blood flow would shut down, and there's still going to be some sort of channel, though, going from the arteriole to the venule. And so blood flow would be highly restricted to just a very small subset of the capillaries when the sphincters are contracted. So basically, the two levels of regulation would be vasoconstriction and dilation of the arterioles, and then constriction or dilation of the precapillary sphincters. Okay, I think we mentioned before that exchange of substances between the blood and the interstitial fluid takes place across the thin endothelial walls of the capillaries. So essentially all exchange of, say, oxygen, CO2, glucose, various other things in the blood takes place there at the level of the capillaries. And that makes sense because these have very thin walls. And also we talked about the fact that the velocity of flow is very low in the capillaries relative to the velocity of flow through, say, major arteries or major veins. So blood pressure itself exerts a force, and it tends to drive the fluid out of the capillaries. And so at the same time, there is a tendency for water to move back by osmosis from the interstitial fluid. The interstitial fluid is a fluid that bathes the actual cells of the body. So there's a big difference between blood plasma has a certain level of protein, and it's much higher than the level of protein that's in the interstitial fluid. For other things such as sodium, potassium chloride, magnesium, calcium, those values are actually roughly similar between interstitial fluid and blood. So the main difference is this lack of protein in interstitial fluid and the presence of proteins in blood. And so these proteins take up space, and so they essentially lead to a lower water concentration in the blood plasma compared to the interstitial fluid. And so then water would tend to move down its concentration gradient from an area of high water concentration, which is in the interstitial fluid, into the blood plasma. And so that is in fact osmotic water flow, so, or osmosis. And so the water would tend to move backwards. On the net change, though, is that the blood pressure tends to drive out more fluid than the amount of fluid that flows back. And so there's a net movement of water or fluid out of the blood plasma and into the interstitial space. Okay, so that would be a problem. There needs to be a way to recover that fluid. And so we'll talk about that in the next slides. Here's a nice picture from your book illustrating what we were just talking about. So if you look at a capillary, well, there's an arterial end. I mean, this is closer to the aorta, right? So there's higher blood pressure coming out of the heart. And there's a venous end. So this is going back towards the right atrium. And that's going to be much lower pressure because of the reasons we outlined earlier, which is there's a tremendous drop in pressure as due to the friction of the fluid moving through these very small diameter capillaries. So you'd expect the blood pressure to be higher at the arterial end of a capillary compared to the venous end, and that's exactly what happens. And it drops more or less linearly as you move along in length through the capillary. So this blood pressure is high enough that it pushes fluid out of the capillaries into the interstitial fluid, which is the fluid, again, which bathes all these cells in the tissues of the body. At the same time, there's this osmotic pressure, and that's due to the fact that there are blood plasma proteins, and those take up space. And so there's less water. The concentration of water is lower in the blood plasma compared to the interstitial fluid, and water will move down its concentration gradient from the interstitial fluid and into the blood plasma. And you notice that this is drawn here as being more or less constant. So there's a constant flow of water back in. But the overbalance is such that there's more water leaving the capillaries than there is water entering the capillaries. Okay, so this would seem to be a big problem if there is a certain amount of fluid or water leaving the capillaries all the time. Well, where does it go? How does it get reintegrated with the blood? Well, you have the lymphatic system. This returns fluids that leak out of the capillary beds. This fluid that's lost by capillaries is called lymph. The lymphatic system drains. It's a vast system of small vessels that collect this lymph. And they finally, it's like small rivers, joining other small rivers and so forth, until you have fairly large vessels, lymphatic vessels that drain into the veins in the neck. And so the lymphatic vessels are very interesting. Some of them can contract, and so they can push the lymph along to help return it to the veins and so forth. And so the fluid would then be able to rejoin the rest of the blood plasma. They also have valves, and this also helps to prevent things like backflow of fluid. Here's a very nice picture from your textbook illustrating this idea. So we have an arteriole here. You have a venule over here. And what you can see is water is leaving these capillaries, and they're being picked up by so it enters into the water enters into the interstitial fluid, but then this excess water is then picked up by the lymphatic system, which is shown in green here, and it's channeled and pumped back towards the heart. And here you can see, for example, one of the one-way valves in the lymphatic system. So the lymphatic system is very, very effective at picking up this excess interstitial fluid and helping to channel it back towards the major veins, where it then enters back into the circulation of the blood plasma. But the system isn't perfect. There are situations in which you may have experienced edema, which is swelling of tissue. A classic example is when someone's on a very long plane flight. So, for example, if you have a 12-hour flight or something to Tokyo or something crazy like that, and you're not able to get up a lot, it's a very packed plane, then you can have swelling of the feet and the lower legs. It can be pretty extreme. You can have a hard time, for example, getting your shoes on again at the end of 12 hours of just sitting there and not really being able to move around a lot. So one way to get around that, of course, is you can do things like use travel compression socks. Those squeeze the lower legs, and that helps you not have this edema. The other thing you can do, of course, is if there's a chance, you would get up and move around, and that would help to push some of this fluid back up towards the heart. Lymph nodes are also very important in terms of their immune function. They're organs that filter lymph, and they play an important role in the body's defense, immune defense. So, for example, when the body's fighting an infection, the lymph nodes will become swollen and tender. And you have lymph nodes, for example, in the neck and various other places, and a doctor may palpitate or feel those lymph nodes to see if, in fact, if they're swollen and tender. And that would indicate that your body is fighting an infection. In the interest of time, we're going to skip concept 42.4, which is the blood components. I do want to talk about cardiovascular disease. So cardiovascular disease is very important for because many people suffer from this, particularly as they get older. There are disorders of the heart and blood vessels. These diseases range in seriousness from minor disturbances of vein or heart function to life-threatening disruptions of blood flow to the heart and brain. So one type of cardiovascular disease is called atherosclerosis. This is also referred to as hardening of the arteries. And this is caused by a buildup of fatty deposits or plaque within the arteries. One major factor in this buildup is cholesterol. So you may have heard that eating food that's very rich in cholesterol can actually be damaging. So that is the case for people that have the beginnings of atherosclerosis. So why is atherosclerosis so bad? Well, one thing is it leads to high blood pressure. So we mentioned earlier that the aorta and the other major arteries need to be very elastic. Well, if you have these fatty deposits, they can in fact lead to these arteries becoming very stiff and hardened. And again, if they're not elastic, then as the blood is being ejected, then the pressure can be very, very high. And this would, so you'd see a very high systolic blood pressure in people with atherosclerosis. Atherosclerosis is also bad because you can have other complications, such as narrowing of the actual lumen of these arteries. And then that can lead to difficulty with blood flow. So cholesterol is actually something that's very important and an important component of all the cell membranes in your body. So you do need some cholesterol, although your body is able to synthesize it if you don't have any in your diet. But it does need to be delivered to cells. And so you have these low-density lipoproteins, or LDLs. So what these are essentially these balls that have cholesterol and protein and things like that. They can travel around in your blood plasma to where they're needed. Now, on the other hand, there's HDLs, which are high-density lipoproteins. These scavengers, they scavenge excess cholesterol and help to return that cholesterol to the liver, where it can be broken down. So you may have heard of this before. The risk for heart disease increases with a high LDL to HDL ratio. In other words, you want more of the HDL and less of the LDL. And also associated with having a bad ratio is inflammation of the cardiovascular system. And so that can also lead to cardiovascular disease. Here's a picture from your book showing what can happen. So we have a blood vessel. So you can see the endothelium here. And within that, you have a plaque that's developed. And on top of that, you have a thrombus. The thrombus is a kind of blood clot that develops within blood vessels and are often stationary, but the problem is they can break free, these thrombuses, and then they could get lodged in a fine artery, such as a coronary artery, the arteries that go to your heart, or other places where you have very fine blood vessels, such as within the lungs and so forth, or even within the brain. A heart attack is also called a myocardial infarction, and this is occurs when there's damage or death to the cardiac muscle itself. And again, this can result from the blockage of one or more coronary arteries, and it could be the situation I just outlined previously. You could have a thrombus that breaks free from another part of the body, and it may travel to the coronary artery and then block one. Or something could break free within the coronary arteries themselves. You could have a thrombus there that would lead to occlusion of a coronary artery. And so when you have occlusion of the arteries, that can actually lead to death of a region of the heart muscle. Equally devastating are strokes. Stroke is death of the nervous tissue in the brain, and this can result from rupture or blockage of arteries in the head. Now, sometimes there is a bit of a warning. So, for example, before heart attacks, a patient may feel angina pectoris. This is a chest pain caused by partial blockage of the coronary arteries. So one treatment for blockage of the coronary arteries is to use a stent and a balloon. These are inserted into an obstructed artery. It could be other places in the body also. The balloon is inflated. This expands the stent and widens the artery, helps to maintain it open. Eventually, the balloon is removed, leaving the stent in place, and this leads to increased blood flow. There actually have been studies also that have shown that if it's possible to not put a stent in, radical changes in diet and exercise can also have an equally efficacious change. Of course, if this goes too far and actually the coronary arteries, for example, are actually in danger of really being blocked, then maybe a stent would be necessary. So one thing that's good about cardiovascular disease is it's highly preventable. So a high LDL to HDL ratio increases the risk of cardiovascular disease. This ratio has a lot to do with the kind of diet a person has. So a diet that's rich in animal fat is going to lead to a higher LDL HDL ratio. A diet higher in plant fats, things like olive oil and so forth. Remember, fats and oils are essentially the same thing. Fats just happen to be solid at room temperature. So diet can change this ratio. Of course, exercise is also influential. Portion of LDL relative to HDL can be decreased by exercise and by avoiding smoking and foods with trans fats. So trans fats are really a hugely terrible foods. So most, for example, vegetable oils are non-saturated, meaning that they are have double within the hydrocarbon tail. If you have a triglyceride, you have a glycerol, and then 3 fatty acids. And if they're non-saturated, then they tend to have a little bit of a kink. They're not straight, in other words. And that leads to them not lining up or stacking together and being solid at room temperature. And so those are so non-saturated fats like olive oil and canola oil and so forth tend to be actually fairly healthy. Um, so again, you would look for oils and things that are not solid at room temperature. Notice that animal fats tend to be white and solid at room temperature. So trans fats, so most trans fats are very unusual in nature. They're usually produced by chemical processing of unsaturated vegetable fats. So for, and so this leads to them to essentially making the removing the kinks so that the hydrocarbon tails are no longer bent but actually straight. And that, there's reasons for doing that for food. For example, you could make food that lasts longer, has a longer shelf life, and things like that. When they make cookies or something like that. So there are reasons for doing it, but these are highly unhealthy. They're really terrible. So you can try to avoid trans fats if you can. So finally, for people that do have a bad LDL to HDL ratio, there are drugs called statins that reduce the LDL level, and they can also reduce the risk for heart attack. Another risk factor for atherosclerosis and thrombosis is inflammation. So inflammation generally increases a bit as people get older, but it's not necessarily always the case that people that as they get older are going to have more inflammation. This is probably most influenced by things like, again, healthy diet's helpful, but also exercise is extremely important. Exercise can actually lead to a short-term acute inflammation, which you've probably felt if you exercised really hard. But people that are in shape generally have a better response. In other words, their overall inflammation is lower than people that are out of shape. So being active and healthy and doing exercise is really good. Aspirin can also inhibit inflammation, and sometimes recommended for people that are at risk of heart attack and stroke to take medicine such as aspirin. Hypertension or high blood pressure also contributes to heart attack and stroke, as well as other health problems. And hypertension can be controlled by dietary changes, exercise, and medication.